It is now 8:03. January is National Blood Donor Month, but right now hospitals nationwide are facing an unprecedented shortage of blood supply.
Joining us to talk about the crisis is Claudine Van Gonka with the San Diego Blood Bank. Claudine, are you able to hear us by any chance? She might not.
Good morning. There we go. I can hear you now.
Right, great.
Okay, there we go. Well, I know we spoke last week, Claudine, about the situation. Currently, it's certainly happening here in the county, happening nationwide too. Is it accurate to call this a crisis?
Absolutely. Here in San Diego, we like to keep about a 7-day supply of every type on the shelf. And to put it into context, for the last few days, there have been some types where we're at a half a day. As of this morning, I did check the blood levels. People are hearing you. They are starting to come and donate, thankfully. But we need more people, healthy people, to come and donate as soon as possible, because we always say it's the blood on the shelves, the blood already on the shelves, that saves those lives.
Some people are starting to hear that message. What is behind the shortage? I know COVID playing a big role, but are there any other factors?
Well, this time of year, in a good year, we usually have a little bit of trouble collecting. It's just people are getting back into the swing of things after the holidays. Blood donation just isn't normally top of mind at this time, but it is really COVID that is wreaking havoc on the blood supply. People are sick, so they're not able to keep their blood donation appointments, and blood drives are canceling. A lot of people are still working from home and not feeling comfortable coming out to donate blood, and so it's kind of the perfect storm right now, unfortunately.
Can you help reassure people about the safety of donating? What if you've had COVID, for instance? How does that process work to be sure that you're eligible right now?
Absolutely. So first, I will tell you, you're not even allowed into any of our blood mobiles or any of our donation centers without getting your temperature taken and getting a series of questions asked about COVID. We are social distancing in our donor centers. We are wiping down everything in between donors, all the beds, all the pens, all the file folders. Masks are mandatory for donors and staff and volunteers, anyone in any of our centers or mobiles. And what was the second part of your question? Oh,
Eligibility. And what about if
eligibility.
if you've had COVID? How
Yeah,
long do you have to wait?
sure. So general eligibility requirements are that you're 17 years of age or older, 114 pounds, and in general good health. So no sniffles, no coughing or anything like that. And guidance just came out that reduced the number of days that you have to wait to donate after you had COVID. So it's 10 days after the last day of your symptoms, you are able to come in and donate.
Well, that's good to know. And let's talk a little bit more about the logistical stuff. Do people have to make an appointment? Can you walk in? What are the rules right now?
Sure. We request that people make an appointment. We want to make sure that we're staffed up accordingly. However, given the situation, we welcome walk-ins. If you're just not sure if you can make a certain time or day, please do walk in. And we have 8 donation locations throughout San Diego, anywhere from Vista to Chula Vista.
Claudine Van Gonka with the San Diego Blood Bank, we thank you so much. Oh, and I mentioned too, it's National Donor Month, so this would be a good time to start a new habit, a new resolution for 2022.
It is. January is National Blood Donor Month, and it's just a perfect time to ask people to start making blood donation a habit and come every time you're eligible, because if people did, we could avoid blood shortages altogether.
Here's hoping. I hope they continue to get the message. Claudine, thank you so much for helping us put the word out this morning.
Thank you.